The Richmond Health and Wellness Program, RHWP, is a collaborative care coordination model that seeks to improve the health outcomes and enhance the lives of the individuals in vulnerable, older, and or disabled populations residing in low-income settings. RHWP brings together students from the VCU School of Nursing, Pharmacy, Medicine, Social Work, Occupational Therapy, and the Department of Psychology to provide integrated care to residents in multiple apartment buildings that are designated for older adults and those with disabilities.
Since the program's initiation in 2012, clinicians and volunteers have touched roughly 1,020 unique participants. Of those patients with documented chronic conditions, 296 are living with hypertension and 149 with diabetes. The best way to adjust doses and make appropriate plans for these individuals is by gathering daily numbers like blood pressure and blood glucose readings. And currently, many of those patients do not have access to the devices they need to do this. With the funding from this grant, our plan can be implemented to better meet those needs, improve individual patient satisfaction, and put our elder neighbors on the path towards aging successfully and maximizing longevity.
Well, only 1 in 4 adults in the US have their hypertension under control. We know the importance of controlling hypertension to reduce the risk of cardiovascular disease, kidney failure, and other macrovascular complications. With care shifting to telehealth, RHWP participants at home need a way to self-measure their blood pressure. Data suggests that doing this at least twice a day, in addition to additional support like lifestyle modifications and telehealth education by pharmacists, significantly improves blood pressure control and reduces these risks. As for diabetes, it's the leading cause of kidney failure, lower limb amputations, and adult onset blindness in the US, and also increases the risk of death from heart disease or stroke. Many RHWP participants need a way to continue collecting real-time info on their glycemia status via self-monitoring blood glucose, which is essential in their management of diabetes. Patient-specific blood glucose and A1C goals predict diabetes complications like economic burden, macrovascular disease, and microvascular disease. Controlling diabetes controls some macrovascular complications of hypertension and vice versa.
Unlike in-person clinical services, it is challenging to obtain real-time quantitative health data from the patients, and it is extremely crucial to assess these data for patients with hypertension or diabetes. Therefore, we would like to use the grant sponsored by Walmart to improve the health outcomes of the patients at risk in a virtual setting by providing the necessary health supplies.
We have estimated that with the funding of this grant, we could purchase approximately 30 to 35 blood pressure cuffs, 25 to 30 boxes of blood glucose meter kits that come with lancets and test strips. Based on our estimates, we'll also have about $200 left over for PPE, supplies like gloves, Band-Aids, and alcohol pads, which are critical, especially for older adults who are at increased risk for getting sick from transmitted germs. While this funding would help meet an immediate community need, sustainability is not lost if you fund this project, because we'll be working with key community stakeholders and advocates who are compassionate for elder care, centered around aging in place. And as patients move in and out of the program, these supplies will make an impact that will last for years to come. We'll have enough supply material that can be easily cleaned and dispersed, and by purchasing supplies that will not become obsolete, like the Omron cuff, which is automatic, simple to use with a touch of a button, and the Freestyle light strips, which were specifically requested by site coordinators because they're easily accessible, cost efficient, and compatible with what the Richmond Health and Wellness Program patients are typically provided when they're taught how to use them in the clinic. You can be assured that by endorsing this project, these grant funds will effectively and efficiently promote sustainable health outcomes.
My name is Emily Perrin, and I am an associate professor at the VCU School of Pharmacy and a pharmacist working with the Richmond Health and Wellness Program. On behalf of RHWP, I would just like to thank you for considering our application. This money will absolutely make a difference to support our mission of providing care coordination and wellness services for low-income seniors throughout the Richmond area.
As SNPhA's vision to serve the underserved, RHWP also aligns with the vision to serve the underserved community at Richmond, Virginia. Tell me and I forget, teach me and I remember, involve me and I learn. This framework of RHWP and our grant proposal is all about active involvement between providers and patients, regardless of distance and telehealth setting. By involving older adults in their care, we can better empower our patients to better understand and be more involved in improving their care.